And but now we're welcoming up Donna Shalala.
All right. Hi, thank you so much for joining us.
Thank you.
I want you to point out I was not late.
No, you were not.
No, she was not.
Apparently the Republican candidate doesn't know about Miami traffic.
Yeah. Well, Washington is worse, I
Yes.
imagine.
All right, well, I don't know if you...
It's not.
It's not?
The lights are coordinated in Washington.
Is that right?
Yeah.
Well, I don't feel that way.
Personally, it's hard. Well, we were talking before you came on stage about kind of this anti-incumbent sentiment that is happening around the country. Joe Crowley in New York lost earlier this week in a big stunner. I wanted to get a sense from you. You served in President Bill Clinton's cabinet. How are you threading the needle of experience and why that's a good thing with making sure you're not too associated with the swamp and then kind of throw the baby out with the bathwater?
Yeah, I was never in the swamp. I worked for an administration that was very dynamic, balanced the budget, created the Children's Health Insurance Plan. We immunized all the kids in the country. So we did lots of very good things. I'm hardly a Washington insider. I've spent most of my career running universities with young people rotating through. So in many ways, I've had very different kinds of experience running large, complex institutions, but mostly related to young people and to their experiences and their dreams. And one of the things that you get when you run universities is they keep you young. They keep you young because...
And on your toes, I imagine.
Oh, you bet.
One thing that you hear kind of in a lot of races across the country is many of the last generation of Democrats, Clinton Democrats, are not progressive enough for this time. That's something undoubtedly you've heard. You're nodding your head.
Yeah.
What do you say to that?
Well, when I went into the administration, I was considered the most left of the people that came in. They had all sorts of names for me on the Republican side because I had led universities, and most recently then the University of Wisconsin, which is a long liberal-leaning institution. I've never changed my basic views. I sat on the board of the Children's Defense Fund with Hillary for almost 15 years. I've been deeply committed to children in particular and to their futures, and have worked with young people, as I indicated, all of my life. So those values about the role of government in helping to lift people out of poverty, in making sure that every child in this country had an opportunity no matter where they lived and who their parents were, have been values that I've carried with me no matter which administration I was in.
Talk about that, though. I mean, there have been some evolving views in the Democratic Party. Medicare for All, for example, is one of the hottest issues this cycle. Where do you fall on that? Are there other positions maybe on marijuana policy or other things that you've had a difference of thinking, from 20 years ago?
Yeah, let me start with Medicare for All. It's not a new idea. Universal health care is not a new idea. I have marks on my back from Hillary trying to get universal health care in this country. Expanding the role of government is what Medicare for All is about. I happen to believe that we should allow people to keep their private health insurance and add a public option, the Medicare for All option. I introduced, actually, we talked to the Congress just before we left the administration about allowing people to buy into Medicare if they were 55 and older as a way of taking care of the pre-existing condition issue. So I absolutely have said that expanding the Medicare program is important, but I would allow people to keep their private health insurance. You have Blue Cross Blue Shield at Politico.
We just changed it.
Just changed it to who?
Cigna.
Okay, you changed it to Cigna. You have better health insurance than Medicare. And before we start passing around Medicare, first we have to protect it, because the Republicans have already announced they want to take on Medicare. We have to make sure we continue to get pre-existing conditions covered by our health care plans. Medicare does not have long-term care. No one wants to give up their private health insurance, and no one wants to get on to Medicare until we figure out a way to get Medicare having long-term care. It's been a position of the AARP for a long time. Nursing homes, home health workers, they are not covered by Medicare today. So we have to be extremely careful as we're expanding health care to make sure whatever we're offering is more comprehensive than it's ever been.
Where did, you spoke about a public option, but where did the Affordable Care Act, Obamacare, where did that go wrong, if anywhere?
Well, where it went wrong is the Republicans took over and we couldn't make corrections in it. I mean, usually when you do a very complex piece of legislation, you can come back and make what you would call technical corrections. We were never able, you never get it quite right. There are always unintended consequences. So you want to make corrections, whether it's the depth of the subsidies or offering a public option. You have to be really careful as you introduce complex legislation. You're never going to get it right at the beginning. You're going to make adjustments as you're going along. We added, well, the Republicans actually, George Bush added a drug benefit because it was a 1965 plan. We've got to add long-term care to Medicare. We've got to find a way to do that, but we have to protect the program first. Look, I've had a lot of football teams. You win football games with defense. And so we've got to start by protecting Medicare and Social Security and improving Medicare, but we also have to keep our focus on universal care, whether you want to call it Medicare for all or whatever you want to call it. We have to fill in and make sure that everyone has good health insurance coverage, but that the outcomes are good. You can have great insurance and the outcomes may not be good because of how fragmented the system is. My staff says I know too much about healthcare and that I ought to shut up after about 2 seconds of labels, but
Whatever.
whatever.
I want to ask you a political question on that, because you don't hear, I mean, maybe I'm wrong, but you don't really hear that much anymore, full-throated defenses of the Affordable Care Act, because in 2010, 8 years ago, 63 Democrats lost their seats, and you can make a salient argument that many of them were because they voted for that law. So why was it so politically toxic?
They won't lose their seats now. They're all going to defend Obamacare. There are 100,000 people in this district that have the Affordable Care Act, that have signed up for the Affordable Care Act. That's a lot of people that wouldn't otherwise have health insurance. And, you know, we had some of the same problem in the Clinton administration. As you know, we lost the midterms. Now you lose midterms. We lost them in part over health care.
One of the big debates, and we asked a previous candidate up here about this, was Nancy Pelosi, whether or not you would support her to be leader or speaker. Where do you come down on that? I assume you know her well.
I do know her well, and she's a friend, and there's no question about that. But, you know, I just think it's presumptuous for us to say exactly what we're going to do when we get in office on individual leadership questions. So I have not taken a position, but let me say this. We would not have Obamacare without Nancy Pelosi. It was her backbone, as you well know, that said to the President of the United States, we're going to do this.
But do you have, I just want to follow, but do you have any questions or concerns about a leadership that is 77, 78 years old, all three in a row?
I don't. Look, let me answer that question. Age is a number. My mother practiced law into her 90s. She won a tennis tournament in her 80s, a national tennis tournament, the national doubles for 80s. She passed at 103.
Did you ever beat her in tennis?
No. Even when she was in her 70s, I sort of was more competitive with her, but my mother was a fierce competitor.
Your seat, the seat you're running for, not your seat, but the seat you're running for, most political prognosticators say it's the most likely to flip. Its current inhabitant is retiring, Ileana Ros-Lehtinen. What has she done in office that you agree with?
Well, her position on LGBTQ rights, of course, because she's been in many ways a progressive on gay and lesbian and transsexual rights in our community. She also has serviced the community very well. I mean, her staff has not only answered questions, but intervened. There's no question about that. She's been loyal on social issues. I mean, she is determined and has been determined to try to pass an immigration bill. She's reflected parts most of the district in that regard, because this district is committed to immigrant rights and to immigration reform, and a decent immigration reform. So she's a friend of mine. Everybody in this room who's from Miami knows Ileana. And so Democrats will be different. For one thing, we'll be in the majority, so we'll be able to get some of the social things done that she cared about. Just protecting LGBT rights in the Congress will be important as the Supreme Court will be a big challenge for us. So I respect her. We've had a lot of fun together over the years, but I'm a Democrat. And at the end of the day, I'm a Democrat.
She's been in Congress a long time, a Republican representing this district. What are the challenges that you're seeing in your race?
Well, the challenges are challenges of inequality. It's a big district. It has some of the richest areas in the world, and it has some of the poorest. So the challenges of the district are the challenges of the country. A diverse population. Half the kids in this district are on Medicaid. That tells you something. Even though it's one of the wealthiest districts in the country, at least a third, are over 65. So it's also a district that has some seniors, a significant number of seniors. It votes, it pays attention to politics. It has our biggest business district, obviously here, and a dynamic business district. And it has huge traffic problems. I could run a congressional race on recommendations to fix traffic in this community.
Will you?
Well, I'm mentioning it. Every time I mention it on the radio, the phones light up.
Oh, sure.
What is leave aside healthcare for a second, what are some of the biggest issues that you hear with the 50-plus set? That's such in this state and all over the country, such a crucial
People are concerned about Medicare and Social Security, about protecting it. That's what I meant about defense. They're concerned about whether it's going to be not there just for them, but for their children and their children's children. But let me say this about Medicare and Social Security. We all think of it connected to seniors, to people over 50. It is, in fact, a middle-class subsidy. If you think about the impact that those two programs have had on middle-aged, middle-class Americans, I tell my students, because I teach this stuff, that no American family would be able to buy a house or buy a car or send their kids to college if Medicare and Medicaid, Medicare and Social Security and Medicaid were not in place. Because if you come from an ethnic family like mine, if we had to reach into our paychecks and try to buy insurance for our elderly relatives or try to give them the dignity that Social Security provides, it'd be a whole different world. So we can't think of these programs just as for people that are 65 and older. They're much more important than that. They're interwoven and inextricably tied to the future of this country.
One of the things that we spoke about at the top of the program, which is so fascinating as part of the polling that we did in association with AARP in this event, is that Republicans on the generic ballot are still doing pretty well, and which is an interesting point of view, considering, as you mentioned at the top of our conversation, that presidents tend to lose their first midterm, lose the House of Representatives. Why do you think Republicans are faring so well in polling?
Well, the public is split in
As it
terms of
always
their
is,
support, in their support of Donald Trump, but we haven't engaged the election yet. People are just starting to pay attention to the issues in the election. You separate children from their families, and you start talking to Republicans, and they're disgusted. It's an immoral, evil policy, and we need to stop it. And obviously the court has started to be helpful, and the president signed an executive order, but we'll see whether they do it. I ran that agency. I ran ORR, the Office of Refugee Resettlement. We resettled families. It was not designed to take children away from their parents and to put them in separate facilities. It was designed to bring in families, to process them over a couple-week period, and then to send them out to communities to be hosted by Catholic Charities or Lutheran Family Services or other church groups around the country. These policies are un-American, immoral, and they're frankly evil. And frankly, for Democrats and Republicans in this community, we abhor anyone that would separate a child from their family.
We talk about you were alluding to the tone of politics right now that is happening. And one of the things Jake and I were talking about backstage was thinking to ourselves, you've been involved in politics a lot of time, you left, you were doing a lot of other things. Why run for office? I mean, Congress can be a pretty bleak place to be these days.
Not these days, all days.
You don't seem very bleak.
No, I like it. I like it. So.
You know, I woke up one morning and I turned on the television and I just got pissed off. It's as simple as that. I've been a problem solver all my life. My career has been made by running very complex institutions and getting things done and making them better. Whether it was the Department of Health and Human Services or the early days when I was in the Carter administration, doing solar energy and getting lead paint out of our public housing projects. I'm focused on getting things done. I've worked with the Republicans over the years, but many of them will have gone, and others have different kinds of attitudes. But I'm focused on getting things done for this community at this time. And for us, sea level rise, an infrastructure bill that will deal with both that as well as the traffic issue, my favorite issue. An immigration bill, that's what's important to this community. All of those issues ought to lend themselves to both parties sitting down and getting it together.
Well, you know, it's striking because Hillary Clinton ran on many of these issues and didn't win this state or this country.
But she won this district by 20 points.
She did. I'm curious what you think. Put on your political prognosticator hat for a moment. Okay, hat's on. Why did she lose?
She didn't. I mean, she won the majority of the votes in this country.
Donald Trump would disagree with that.
Yeah, but you know, it was the same reason that Al Gore won the majority of the votes. Let me say this. I'm a Midwesterner. I grew up in Cleveland, Ohio, in a working class district. My cousins are disaffected. They don't think that their kids are going to have better lives than they've had. They certainly aren't having better lives than their parents had because their parents worked in the steel mills and made good union wages. I spent years in Wisconsin, not just in Madison, but all over Wisconsin.
State that went for Donald Trump?
And a state that went for Donald Trump. Ohio went for Donald Trump. I mean, these are places where people are disaffected in large part because the world has changed under their feet. We didn't make the kind of investments to provide them with the opportunities of the future. I have cousins that work in the nursing home industry. They're practical nurses in nursing homes. And those are not very good jobs these days. Childcare workers, janitors, all of these jobs, we have to find a way in which we can lift people out of poverty who get up every day and go to work. We have to find a way. It's not just a matter of creating new jobs in technology. You say that to my cousins and their eyes glaze over. Sure. They want their jobs to be better, and they want the government, the tax system to work better for them. You want to talk about an unintended consequence? I just got a letter from the university that basically said anyone who got the subsidy for taking public transportation is now going to be taxed on it under the tax bill. During the debate on the tax bill, was anyone talking about people who got subsidies from their employers to take public transportation that was now going to be taxed? We were all focused on whether Harvard was going to get taxed on their endowment. These are people that get up every day and go to work. They're doing the right thing. They're saving the environment by taking public transportation. And now they're going to be taxed on the subsidies that a good university gives them so that they can take public transportation and we can reduce the number of cars in our community.
On the tax bill, we did an event with Nancy Pelosi not too long ago, and she said she would roll back some of the tax cuts for the upper income earners. Is that something that you agree with?
I want to see the details on that before she says that. She says it for the upper income earners?
Yep.
Yeah, I want to see that. I want to take care of the workers first. I've always believed that we should look at the payroll taxes. People are worried about what they have to pay out of pocket. That's the survey of seniors. What they're concerned about is their out-of-pocket costs for health care. What people that live from paycheck to paycheck, most of the people I've supervised, over the years in the universities where I've worked, they're worried about their after-tax dollars, about us taking money out of their pocket so they can't meet their bills. I've always looked at the world from the point of view of the people that are going to be the beneficiaries, and I've forced both my students and the people that I've worked with to think about the end game as the beginning, to think about the people that are going to be affected. And I can tell you story after story about how we change policy after we talk to people.
Before we let you go, because we are going to get the hook here pretty soon, I want to ask.
Are there real hooks?
Yeah.
No, well, I
On
hope
the
not.
prognostication factor, though, Florida, you said you predicted that you think the House is going to go to Democrats. What do you think is going to happen here? What do you think is going to happen with the governor's race?
Well, I think we're going to win the Senate race here. I think Senator Nelson is going to win, and I think we're going to have a Democratic governor. Now,
Have you endorsed a gubernatorial?
no, I have not. I have too many friends that are running. 3 friends in particular, but I have too many friends that are running, so I actually have said to each of them that I just can't.
You don't have one friend that you like more than the others?
No.
Okay.
That's the only political answer I'm giving you today.
All right, well, we appreciate your time. Unfortunately, I am hearing from our folks backstage that Stephen Marks is stuck in traffic and is unable to make it.
As you said, I guess that's a problem here.
You gotta know the district.
But we want to say thank you to AARP, which has been a tremendous partner. We're excited about our future events in the Deciders series, and thank you very much for joining us.
You're welcome.
Thank you.
Thanks
Thanks
a lot.
so much.
It was
That's
fun.
great.
That was fun.